Hi, good evening to all of you, and heartiest congratulations,
Thank
Rekha,
you, ma'am.
Noor, Nasma, Rania. Many congratulations. Really, it's really nice to see you all passing and getting this prestigious degree. And like you all need a pat on the back. Really, it's your hard work, your dedication, and your determination. And I know some of you have cleared the exam in first attempt. For some, like you gave many attempts. For some, it was the last attempt. And like by God's grace, you all passed this time. And you are all members of the prestigious, you all are now the MRCUGs, like member of Royal College of Obs Gynae. And like I'm extremely happy for you. Like congratulations to you, to your family, and to everyone. And like, tell me, how are you feeling one by one? Rekha was there. So yes, Rekha, tell me, how about you feeling? And you can tell how did you prepare? You can give some advice to the candidates.
Yes, ma'am. I'm feeling very good, of course, after the passing the exam. This
Yes.
was my second attempt. And last attempt, I learned a lot because in some of the stations, like in the structure discussion, it was there. But I still like bridging thromboprophylaxis station was last time I have. So I started like in the teaching manner. So it's very important to read the task in a proper way.
Yes.
And because if we don't know that how we are going to do, so it will be very difficult to perform in the stations. So reading the task in the proper way and what they are expecting from us is a very important tip which I learned last time from my mistake. And also we in the 2 minutes utilization of the time was is very important, that what we have to do perform in the station, like this time I have to some new task as well. But even if you are taking the new task as well, I think we don't have to be worried. Even we don't know anything, but we can pass in the information gathering and the communication with the colleagues, and even the communication with the patients, the clinical knowledge we have some
Yes.
or somewhat from our background knowledge, so we can we will not perform 100%, but we can perform somewhat in the borderline or not 100%. So don't be, I think, don't confuse whenever you take the new task.
Right.
And also um,
Because the new
uh,
task, we know the domains, we have information gathering. It's easy to pass. Like we all are very
yes,
comfortable
ma'am.
in history. Communication with
Hmm.
colleague, it is an easy domain to pass. Like you will be involving
Yes,
with the colleagues.
yes, ma'am.
And what else?
Communication with the patient we can also pass, and the patient safety, somewhat weak points we can cover and some parts we can miss because it's a new station. So of course in the every exam most of the time they have the recalls, but of course 3 to 4 stations will be there which we get the new recalls. But I think we don't we have to worried about, and we if we get the new station after that we have the recall. As I think performing the good manner will be then a good option. So I first time in the last time I take your course. Also, I take the Dr. Priyata's crash course as well, and one face-to-face mock exam in my last preparation. I taken the courses, but this time because I did not take in any mock exam, but I was preparing with my friend Sahitya. So we arranged the mock for ourselves, and we are taking the mocks for ourselves. So 14 stations in a row preparation before the exams is very important. Either you are preparing with your friends, or either you are taking from any mentor, whatever. If you have the good study partner, you can take that as well. uh, but
Exactly.
fe- uh, but if you are preparing, if you are going for the first time, face to face mock is very important, because because last time I had experience, so I didn't go this time. So um, and
Like
what
study
should
partner, partner is a must, isn't it? And
One study partner should be that much good in which we because we and Saitya were both preparing together, and we are giving the domain wise feedback. So whatever the mistakes we are doing, we are trying our best to not these repeating these mistakes next time. So study partner is very important. Even if you have the 2 to 3 study partners, which I had last time, I had the 3 to 4 study partners. So I think if you have the constant one partner, which and also one to two more, which you are performing the stations randomly, it is also very important because we are getting the ideas from the other partners as well. So study partner is must. Practicing the station is very must, because otherwise if we not practice the stations on the daily basis, so we will forget the things. So practicing the station is very must. And of course mentors good, like Dr. Shabana. So
we are
she
here to guide you. That's all we can
yeah,
do.
yes ma'am. Mentors are for the guidance, and also the self preparation is very important, because when mentors are good, like last time when I take your course, you whatever the mistakes we are making, you are picking these mistakes, and you are not discouraging anybody. That's a good thing, because some mentors also discouraging the candidates as well. So I think this was your a positive point which I feel last time. So also your way of explaining the things in the layman and in the concise manners, this was also the good part from your side as well. Last time I did not clear the exam, that was my maybe luck, whatever. So but of course I was following you, and yes.
Yeah, many congratulations, Rekha. Many congratulations. Like, I have been listening to you, I think, for the last 1 or 2 years, right? You are in the
One
case.
and a half year, yeah, one and a half year.
Yes, yeah. Yes, and like the way you were presenting the cases in the free case discussion group and even in the our courses, like I knew you will do.
Mhm.
So it's just a matter of time. It's just a matter
Yes
of,
ma'am, yeah.
yeah, that's what I say. Like,
Yes, ma'am. The exam is very unpredictable. Even
very,
you performed good. Even last time, I feel that I performed good. But of course, there were so many mistakes which I
yeah,
did, which I realized afterwards that these mistakes I have done. So I will try my best to don't repeating these mistakes next time. So this time I had a good study partner, Sahitya, with me.
yeah,
So
yeah.
we worked hard a lot,
You also
and
passed.
mashallah,
Yes.
we both cleared exam. Yeah.
Mhm. Okay,
Yes.
Rekha. Oh,
Okay, ma'am. Yeah.
okay, my dear. Thank you. Okay, and Noor, what would you like to say? Congratulations, my dear.
Thank you so much, ma'am.
Yeah.
Uh, I
I,
just want to say this was my second attempt actually, and I had appeared in
Mhm,
November as well.
mhm.
So I just felt that what was lacking last time was that I had not practiced enough, because
Yeah.
my study partner, she had to go to Canada for some time to her brother, and we hardly practiced. We had different duty hours and all. So, but
Yes.
this time I was more consistent with the practice. Like almost 2.5 months, we had rigorous practice, and
Right.
daily we used to practice. So daily routine is very important.
Yes.
And yes, you always
Absolutely.
encouraged us in the class. Even if we did some station very badly, you always used to encourage us, okay, try it again, try better next time. But
Mm-hmm.
you never use any harsh words. Because
Mm-hmm.
especially for second attempt, a mentor saying harsh words totally demotivates you, that you can't do it. So I felt that this was a very good point. And also, your ma'am, the audio library was excellent. I mean, sometimes like in the stations, even if you read the template, the theory part, the bullet points, it's difficult to
Yes.
actually articulate the points into sentences, how to speak, because the way of speaking in MRCOG exam is very different from what
Right.
we say in India, how we deal with the patients. So some
Right.
typical words and phrases that they're looking for. So you told
Yes.
us the key points. All your slides, they had those asterisk points and the bold points that don't miss these points.
Mm-hmm.
So even if we had not covered, I mean, all the stations in the class, because it's impossible to cover all stations in any class, but I
Exactly.
got an idea that what is the examiner looking for actually. That
Yeah.
in any station, what are the important points and what we should not miss.
Yes.
So and also in the question in the initial 2 minutes, I just read the question multiple times. this mistake I did last time. I just tried to make a management plan straight away. I just read the question once and I made the management plan in those 2 minutes in the last attempt, which I felt was not a good way because you forget, you miss out what is the basic question what they're asking.
Right,
So
yeah.
because we have already read all the stations, practiced multiple times, so better to read the question again and again to understand completely what they want us to answer
Yes,
and what they want to know from us.
exactly. Because, in 10 minutes, like in 2 minutes, you have to,
Exactly.
like, the
See what,
domains which you will be tested in,
yes.
and
And
also,
read where you are, read who you are, and where you are in labor room, you are in ward, you are in emergency. I mean, it's
yes.
important to introduce yourself correctly because if you introduce in the wrong way, you say I'm in emergency and that patient says, okay, I'm in labor room. So that totally just derails you from the entire task in the first sentence only. So
Mm-hmm.
it's important to be aware where you are, what you're dealing with, and what they want to know exactly. And
Right.
yes, practice is of, I mean, the most important thing is practice.
Mm-hmm.
I
Yes.
used to wonder last time where I went wrong. I had read everything so nicely, but I realized now, in the second
Yeah.
attempt, that I did not practice enough last time,
Mm-hmm.
and I was not very clear about what they actually want to know. No, because
Mm-hmm.
some station which you have read before, and the station comes in exam, you just jump. Oh, I know this station, and we don't read the entire thing properly. It might be something different. Some word here and there, some titles may be different sometimes.
Yes,
So,
yes, yes.
so they want to read the question again and again, multiple times, to know
Yeah,
exactly what is that they want to know.
exactly. And 2 minutes time is very precious. You
Very precious.
you organize yourself in those
Exactly.
minutes.
And some
Exactly.
important point, patient is a smoker or BMI is high. Just write those small points. I
Mhm.
made this mistake last time. I tried to make the management plan and write in my notes. But the thing is, we never open that copy again and see. There's no time to go through that written part again when you're
Yes,
speaking the
yes.
station. So
Right.
no point wasting that time, precious time, in writing the management plan, which we anyway know because we have read everything. Write the
Mm-hmm.
important bullet points, the patient's age, patient's name, especially because sometimes if you address the patient wrong, they get very offended. And I am not this, I am that. So, patient's
Mm-hmm.
name, age, where you are, any risk factors, specific risk factors that I've mentioned, any important vital signs, this important keywords. Nothing much to
Exactly.
write in those 2 minutes actually.
Right. Yes.
And
So,
yes, the audio library was very good, ma'am. Some stations
okay.
which I felt were difficult or could not cover in the templates, I just heard your audios multiple times, like Anand Kefli, and all
Mhm.
these stations which you don't see commonly, which have not come very commonly as well. But
Right.
they can come sometime. They do give one googly station every time. So I just heard the recordings for them, and they really helped me a lot with the odd stations as well.
Right.
You really have done a very good effort, ma'am. You have, I mean, taken all the pains
Mhm.
to make that audio library for us, and hats off to you for the efforts. And the classes are really wonderful, ma'am.
Right, right, right. Yeah. So actually, uh, audio records, like everyone told that, yeah, that's really helpful. By mistake, actually, I stopped the video. Actually, the cursor was there. So if you wish to open your camera, you can open, my dear.
Okay, okay.
Yeah. So, uh, like listening to the audios, like everyone told that was really very good.
Ma'am, I think that the video is disabled. Actually, I'm not able to open it.
Okay, no problem. Okay. Very happy for you, Noor, and you were really good.
Thank you, ma'am.
Took the rapid recall course and very good, very
I used to
good.
always remember you saying, like in class, I used to always talk fast and you used to say, go slow, go slow, go slow. So this thing was
Yes, yes.
ringing in my ear in the exam that talk slowly, don't
Yes,
rush. Lot of
yes,
time is
yes.
there.
Not
So
only to you, Rekha also, Rekha, isn't it? Uh, Rekha used to present the cases in the case discussion audios she used to send. Then
Yes, ma'am, I said, yeah.
we used to tell Rekha that please slow down. Same thing was with Noor, and
I was just
uh,
recalling it in the exam. Lot of time is there. Be slow, be patient. It'll
yes.
finish. And actually, we can finish in 10 minutes. It's not a. I mean, time was not a constraint. I felt. But anyway, we forget something. So anyway, we finish on time. We don't
Yeah,
recall 100 of the station. So
right.
10 minutes is sufficient time. I feel, but we don't need to rush. You can take a breath and think what you want to speak.
Yes, exactly. So well done, my dears. Very
Thank
well.
you, ma'am. Once
Well
again.
done. Okay, we have Nazma here. Hello. Yes,
Hi, Doctor. Hi.
yes. How are you?
Yeah, I'm fine. Thank you so much, Doctor.
Okay, and how are you feeling, my dear?
First of all, Alhamdulillah that I cleared this time. First,
Alhamdulillah.
I thankful Almighty Allah that He helped me to clear this exam.
Mm-hmm.
And second thing, all the credit goes to you, Dr. Shabana,
Thank you.
because
Mm-hmm.
this my MRCOG journey was not easy at all.
Mm-hmm.
I had, but I'm now I'm very thrilled to share my experience. I read a lot. I read a lot. I gained a lot of knowledge. But when I join your course, I understand that reading only not enough. Like I have to be focused. I have to apply my knowledge according to the case and domain
Yes,
wise,
yes,
and practice with the study partner. And in times, like I used to do practice. I finished my case 8 to 9 minutes,
yes.
and each
Mm-hmm.
domain I try to follow. So Alhamdulillah, this time I pass all the domains that I feel very happy.
Mm-hmm. Yeah,
And
your result was par excellence, I must say, passed in all domains with such a good percentage. Yes,
Alhamdulillah,
very
that's
good.
really go to you, Dr. Shabana, because this your no mentor. I don't know you did so much hard work to make this PDF for us, and the voice recording,
Mm-hmm.
and
Thank you.
it is easy for us to anywhere just open the mobile or open the anywhere in
Yeah,
the car, in the duty, to just to quick go through, revise, even listen when even I'm in duty. I could have listened. I'm in the car. I was used to listen, and this was really great effort from you, and I'm really thankful to you, Dr. Shabana.
thank you. Thank you so much. It's all
And
your efforts also.
at the last, I want to say, whatever practice, without practice, we cannot make it possible. We need to practice
Okay,
many times.
exactly.
And
Mm-hmm.
last things I would like to tell that I was not planning to give any mock exam, but
Mm-hmm.
just a week ago, you called me, and really that time I give mock exam to you. It was it boosted my my confidence, and I really got the tips from you because I was little bit faster, and
Mm-hmm.
I work on that last
Yes.
1 more, and it worked really. Alhamdulillah.
Yes, I remember
Thank
even
you so much.
you used to rush a bit, just like Rekha and Noor. Nazma also used to rush, and I always told her that please don't rush. Don't rush because you have to finish your station in 10 minutes, please. Just be yourself. Like you have to see, like you have to speak the way you talk to your patients in the clinic. So, of course, in the exam, you will be having some anxiety. We are all human beings. So, that palpitation is always there. I know. But, like with practice, we say practice. Why we say that? Because with only with practice, you can talk sense in the exam. Because you should also know what not to speak in the exam and how much information you should give to the role player, isn't it? So,
Yeah, exactly. Only
that,
practice will make it easy for that, because
yes.
whatever knowledge we have, if we don't
Yes.
practice how to say, and in times, definitely we have to always practice in the setting the time that I
Right.
can finish this one in 8 minutes. If I can finish 8 to 9 minutes, definitely in the
Mhm.
exam I can finish in 10 minutes.
Exactly. Yes. Okay.
That's what I have to tell. Thank you so
Thank
much,
you.
Doctor.
Thank you so much. Thank you so
So
much.
happy, and congratulations to all my friends who appear, and I really I feel when I did not clear last time, and I feel also who didn't clear, but I encourage them. When our time will be there, and Allah will make it possible at that time only. So we should not be disappointed
Exactly.
from Allah plan. His plan is the best
It
plan.
is his plan. Yes, yes. And like the timings are different for everyone. Like, and we should never give up. Like, it is not over until you get this degree. This has to be there in everyone's mind.
Yes,
Because after doing your part one and part two, you just can't give up. There are people who told me that this is their third attempt. You have one more attempt. Okay, go for that. But if you will not appear in the exam, then how are you going to pass? So you have to take that. I mean, you should push yourself. That's what I can say. And
yes,
Nazma,
yes, exactly.
it is commendable. I would like to say that this was Nazma's fourth attempt, and like she was very anxious, very worried. Anyone will be worried. It is a human nature, and like we had a nice rapport, and then for the Mac mock, like Nazma said, I contacted her. I was thinking about all my uh, candidates, I mean, all my colleagues who were going for the third and fourth attempts. And I contacted, Nazma was one of them, and she passed. And she really worked hard because this was her last attempt, and she really gave in her 200% for this exam. And by God's grace, you passed. And I was waiting to hear from you. And Nazma said that she did not even check the result. One of her colleagues told her that the result is out, please go and see. And then she texted me, and I was really overwhelmed when I saw her message that she has passed. So many congratulations, my dear. Heartiest
Thank you so
congratulations.
much, doctor. And you are not only just mentor, you are, attached so much to your all the candidates. I feel that you are more than mentor. Not only mentor, you feel us from your heart, and you help me.
Thank you.
I believe that if the way you help me, if you helped everyone.
Thank you. Yes, because we have also gone through that phase. So we know it's not easy. It's very difficult because we are not undergraduates, we are postgraduates, plus we have family, we have kids, we have job. So many things are there, isn't it? And then on top of that, this exam is there. So, like many candidates, they told me that it's what a big relief they cleared this exam. That burden is no more now. Well done, my dear. Very well done. Thank you.
Thank you so much.
Thank you. Yes, Rania, how are you? Hello. Rania, you can unmute yourself. Okay, I think she's not there. Okay, Yoga Priya.
Hello, ma'am. Thank you.
Hello. How are you?
Very happy, ma'am.
Very happy. Yeah, you're sounding happy. All of you are sounding happy. So,
At night, 1 o'clock, I just again saw the message like you have cleared part 3, whether it is dream or not, like that. So still
yes,
unbelievable, ma'am.
yes. You told me you were still pinching yourself.
Yes, ma'am. Yes, ma'am.
So,
A very happy moment, and all the credits
yeah,
goes to you, ma'am.
many
Yes, ma'am.
congratulations. Many congratulations.
Actually, I have joined this crash course, and it was a concise preparation, ma'am, what you have given, because there was lot of things to study in part 3, especially. But you have given key points like high pec, and
Yes.
I never expected this high pec and all will come or not, like that. But just like that, I saw your YouTube video and your audio, and that came in exam. So and also selected station like sexual assault and all, you gave more importance. You taught us like teaching station, and also like an empathy station. So that also came in exam. So whatever we discussed in our crash course, that all the stations came in exam, but not exact scenario. It is quite different scenario.
Yes, because like sexual assault, it came as structured discussion and it came as teaching also. The scenario was a bit different. So
Yes, ma'am. For us, it came as like a structured discussion, and they have deviated the station to in such a way, like a big paragraph was given.
Yes.
And I told you that sexual assault, the questions was less, but the paragraphs have given the already some junior doctor have taken the history and recorded in pen drive, and we have to discuss what are the things after the sexual assault. So we have to read the question carefully. Though I didn't read the question carefully, but examiner prompted me. Examiner stopped and prompted me, and we have to listen what examiner is saying. They must
Yes.
be saying in a not in a polite way, in a rude way only, but we have to follow them. So I think I understand what they have asked. I didn't repeat the things again and again during the exam. And your course is so much helpful because you have given n number of presentation during the course. Like for one module, three cases we have presented.
Right, because you people were 6 and 3 of them,
Yes, ma'am. That is our luck.
they
That
became
is our luck.
passive.
Myself and Noor, that is our luck.
Yes.
So so
Yes.
many cases have presented. So there was no problem in starting out the case during the exam. So it comes just like that. Hello, I'm Dr. Yoga Priya. That like
Yes.
that and all takes in 20 seconds like that.
Yes, yes, it was
And
because
yes, ma'am.
you people were active. You and Noor, you were very, very active, and
Yes,
other
ma'am.
active candidates they became passive. And I always used to text them, even in the group and personally, that see, you have to talk. Just going through the PDF and keeping
That is not going to help, ma'am. Just
notes.
going through the PDF and listening to the,
No,
yes, audio is really helpful a lot, but we have to speak the audio.
exactly.
Uh, uh, Not exactly as you, but I used to try like you always speak very slow and soft, and it is like full of empathy and sympathy, whatever required at the station. But I try to copy, but I cannot match up you. But
Mm-hmm.
in my own way, I did all the station. Whatever you have had audio, I also had my own audio. So that was so helpful. Whatever the station I find difficult, sometimes I used to practice with the study buddy. Study buddy is a must one for clearing this part 3 exam.
Exactly.
At least one study buddy is adequate. So we have to be so sincere with our time. That is what I can say to the other colleague who want to clear this exam.
Mm-hmm.
So because we are very busy and our schedule are busy, we have to choose one study partner who has the same wavelength.
Mm-hmm.
And if study buddy is not available, then also it is okay. You have to practice by yourself by recording your own voice. I used to listen your recordings, then I'll practice the station, then I will do my recordings.
Mm-hmm. Okay.
And
Right.
there was lot of difference though, but I used to practice every day. Whenever my study buddy is not
Yes.
available, I don't waste the time. In the
Exactly.
time while waiting, I'll do one station. So whatever the station I did, still my study buddy
Mhm.
comes, I'll do the voice recording of mine.
Right.
So that will also going to be very helpful. And in part 3, it's a very vast syllabus, ma'am. But we
Mm-hmm.
need to know what have to prepare for the exam. So your recall scores, awesome, ma'am. That helped a lot because last 3 months, I just focused only your recalls. Not even there are many cases.
Mm-hmm.
So I just focused only on the stations what you have given in your course,
Right.
and that was too helpful, ma'am.
And until now, what we have observed, exam is 80% records. So
Yeah.
it doesn't mean that the same exact scenario
Same,
will
yes.
come. It can come in different
To
ways. But the
yes,
top,
ma'am. To manage to those stations, like I just want to say say, like
Yes.
we have to present many number of cases, then
Yes.
only we can able to manage whatever the recalls can be twisted like this. Because we have discussed oncology station, there is some station, but that kind of station comes with the vault prolapse for me. In
Right. There will be
question,
some
they have
twist.
clearly given,
There will be
yes,
some
twist.
twist in
Like
this.
question, they have given vault is wall, it is a wall prolapse, like a wall prolapse scenario, whatever what we have read in recall, but it is not exactly the wall prolapse case. Vault is strengthened. One word is given in the question. Vault is strengthened, anterior vaginal wall and posterior vaginal. There is prolapse in the, there is bulge in the upper side and lower side.
Right.
Vault is strengthened.
Mm-hmm.
So it is like a case of cystocele and rectocele.
Yes.
So we discussed only the vault prolapse.
Right.
Wall prolapse on wheelchair, that is the usual recall. But
Yes.
the scenario twisted is cystocele and rectocele.
Rectocele.
So,
Exactly.
yes, ma'am. So, that will comes only after doing so many stations with you.
Mm-hmm.
Like we have discussed a lot of stations. In each module, we have discussed 8 stations. And in library, we got lot of station. I used to tell in the end, ma'am, what ma'am, in library also you're having so many station. Like each
Yes.
module you're having so many station. How you are going to cover it?
Compilation, which yes, I collected because, like I always say that since we have also given the exam, so I always wanted to do something for my colleagues, like so that they don't have to search for materials from here and there. That is why. So, and PDF was like uh,
Yes,
uh,
that is so
that.
helpful after
Mhm.
the last 15 days. That PDFs helps a lot, ma'am, like to
Right.
have a good revision. And your voice recording top notch, ma'am. That one was very.
Thank you. Yes, yes, because you can listen to those voice recording whenever you are free, whether you are at work, you're driving, whatever you're doing. So,
And I just want to tell our friends one thing, because I never finish any station on time. Ma'am, you know well. I used to
yes,
present for 11 minutes. But
yes,
on the day of exam, you don't worry even if you're not finishing on time, because on the day of exam, we are going to remember only few points. So
yes.
on the day of exam, I finished all the station by 8 minutes.
Exactly. You
Because
told me.
yeah,
Yes.
that is the one positive thing I told after finishing the exam, ma'am. The only positive thing, I did all the station in 8 minutes. Like because
Mm-hmm.
role player were telling me like, okay, it is 2 minutes, it is 1 minute, like that. So we were seeing each other only.
Yeah, yeah. Okay. Thank you. Thank you,
Thank
Yoga.
you so much, ma'am. Thank you. Thank you for
You.
all your support. And
Many congrats. Many congrats again. Okay. Rania, are you there, my dear? Hello. Okay, so win-win.
Hello.
Hi. Yes, Rania. Hello.
Hello,
How are you?
Dr.Shabana. How are you?
I'm good. I'm so happy for you. Many congratulations to you.
Yes, Alhamdulillah, Alhamdulillah.
Alhamdulillah.
Congratulations for all the colleagues who passed the exam
Mhm.
on the group. It is very, for me, I am very happy that a lot
Yes.
of people pass in this exam. I know some they didn't pass, but in our group, most of them, Alhamdulillah, they are passing. This
Yes,
is
yes.
because of you. Yes. Uh,
Thank you.
therefore, with us.
And your
That,
hard work also paid off. You worked very hard. Like all the candidates who have passed, I have noticed that all of them were active. Uh,
yes.
we-
Alhamdulillah.
Alhamdulillah. Yes.
This is
And
my second time. This is
yeah, this was your second attempt. Yes.
my second time, and I observed that in my first time I
Mhm.
did, but I need more time because it is 2 months from I passed the
You
second part, the
okay.
third part. So still I need time. So when I took this time with you and
Uh-huh.
I gain a lot of So it needs time for reading, for doing
Yes,
the exam.
and practicing stations. And
Yes.
we should know what is part 3 actually. You people have all the knowledge because you have passed your part 2. But now you are tested in how you're going to apply that clinical knowledge. So that
Yes.
comes only with practice, isn't it? So,
Yes.
mhm.
Yes. So I don't know, but even our exam, it is not easy. This exam we pass
Yes,
because there are many tricks, and
yes,
so question need to understand question very well. As my colleague said, we need to read the question in the station to
right.
see
Mhm.
what the examiner cues, or the cues from the simulator,
Yes, they were mixed
the
with in the scenarios, exactly.
yes,
Topics were
because
same, but
yes,
it. Yes.
yes. Alhamdulillah, we are
Alhamdulillah.
benefit from all
Thank
effort,
you. Yes,
your
yes.
recall, your PDF, all we benefit from all this, Dr. Shabana. Thank
Thank
you
you.
very much for all
Thank you,
your
my dear.
effort.
Thank you.
Yes, thank you.
Congrats again. And we are all happy for each other, really. Really.
Yes,
Okay, my dear. Okay, my dear. So,
thank you.
okay, my dear. Yes, Win-Win. Hello.
Hello.
Hi. How are you?
Hi.
Congratulations.
Thank you, ma'am.
All right. So,
Because
how you feel?
your dedicated work. Yes.
Hello.
Ma'am, what are you? Yes. Can you hear me?
Yes, we can hear you. Yes, go on, please.
Yes. Thank you. Throughout my journey to Mrcog.
Yes, Win-Win, you were very hardworking. That I would like to say because, like you presented the station and then like you did one-to-one also with me. So like you worked hard, really, all of you, in fact. Any advice for your colleagues who are going to appear in November?
Yes, in my opinion, the regular practicing with the study is very important
Mm-hmm.
to set them. And in the station, you told me it is right. Whatever the role player say, please listen to the role player, and then we follow the tasks according to the role player agenda.
Mm-hmm.
That's very and you know, this is not my first attempt. In previously, I sat the exam and I can do. I think I did it really very well in previously, but I couldn't make it. That's because in my opinion, I think I didn't follow the role
Mm-hmm.
player. Uh, I follow with my according to my agenda, and I finish in 10 minutes in previously. That's
Yes.
why I failed the exam in previously. I know that, and this time I what the role player is talking, I let her go according to in 10 minutes.
Yes.
In some station I didn't finish because the role player asked me too many questions. Uh, that's why in that cases you don't need to worry about that.
Yes, if your role player is asking you questions and you're listening to her and answering her questions, you're gaining marks. Because
Yeah,
role
yeah.
player will ask you the questions which carry marks. So that is why I always told everyone that please pause. And even in the PDF, I have written in bold letters those lines. Am I clear so far? Do you have any question? Would you like me to repeat anything? So if until and unless you will not say do you have any question? And you will go on and on with your explanation of the condition, and then you will start your management. She is not going to ask you anything. So yes, Win-Win. And even in the course, I used to say, Win-Win, please be slow. You were also the one who used to rush, isn't it?
Yes, and that's the one thing.
Yeah.
And when I attended the RCOG course,
Yes.
they told me, the examiner told me, the feedback is I'm in rush, and my
Yes.
aim is to finish in 10 minutes. You know, if I am not in finish in 10 minutes, I feel I'm worried that I couldn't make it. So if you are not finished in 10 minutes, don't worry about that. Please follow the role player agenda and ask the role player any questions and answer it all clearly. Because in the exam, some of the questions, for example, hot chemotherapy, it is not included in the main question. You know,
Yes.
it is in the role player agenda. That's
Yes.
in the oncology
Exactly.
question, that is the main things. If you
Right.
hear about hot chemotherapy, the question, if you couldn't answer regarding the hot chemotherapy, the question in that task, I think is the main question for the.
Yes, it was not given in the agenda because hot chemotherapy is still not used in so many NHS trusts. So even
Yes,
in ovarian cancer, it is not the routine management, right? But when you asked the role player the question that, do you have any question? Then she asked that, can you tell me more about hot chemotherapy? So that question was there. If you will, that is what I say, if you will not give her the chance to ask question, the role player is not going to ask you anything. So well done, Win-Win. Anything else you want to say? Any other advice?
yeah, yeah, that's all. I think. So I'm not really good. The thing what I pass is I follow the role player agenda and then the answer the question, and this time it is very lucky to answer 4 Eurogynae stations in this exam.
Yes,
There
Win-Win.
are 4 Eurogynae tasks in this exam. You know,
Yes. Okay.
my specialty is regarding the Eurogynae, so I I I
You
think
managed.
I could make it because of that 4 tasks.
Right. And one thing I would like to say, Win-Win always used to text me, ma'am, my English is not good. English is not good. So please don't worry about your English. This exam is not going to test your English. Okay, so even if your English is simple, don't worry at all. Stock say small sentences, and you should just be able to convey the information. That's all. So well done, Win-Win.
In the labor prioritization, there
Yes.
are 9 to 10 rooms, but I couldn't finish uh, one room because the examiner asked me too many questions. So you don't need to worry that if you are not finished all the rooms, don't worry about that. The main
Yes.
thing is you need to finish all the urgent and semi-urgent rooms.
Right. Exactly. So even in labor board prioritization, please don't rush. Go room by room. If there is an urgent room, pick that room first, and then you can go room by room. Yes.
Yeah,
Okay. Okay, Win-Win. Thank you. And
thank you.
congratulations again. Okay, my dears. So Dr. Fehmida and Sahitya, all are there. Very good. So I can see Dr. Fehmida's name. Yes, Dr. Fehmida. Hello.
Hello, Dr.Shabana, Assalamu alaikum.
Yes. Walaikum assalam. How are you?
I am I'm good, but first of all I would like to congratulate all my friends here in
Okay.
our course.
Yes.
And I'm very much glad and grateful to you, Dr. Shabana.
I'm so happy for you, Dr. Fahmid. I'm so happy. You were such a busy clinician, always on duty. And when I think texted you yesterday, you were on
Yeah,
clinic,
Chennai.
right? Yes,
Chennai
yes,
Chambers.
yes.
Yes, Dr. Shabana, actually, did you remember that I want to be your listener participant? But
Yes,
you said that I have to be an active participant. Actually, at
yes,
that time, how could I manage time to
yes.
be an participant, to talk to you?
Mm-hmm.
Actually, I have to busy from morning to night, basically.
Mm-hmm.
But
Yes,
sorry,
yes.
sorry, one
It's
phone.
okay. Yes, yes.
So actually, at that time, you said that we have to manage partner, but I didn't have any partner. I always talk with myself, and believe me, I just listen to your voice record all the time when I was in my chamber, when free, when
Yeah.
in ward. So any free time, I just listen to you, just.
Mm-hmm.
And I don't know how could I manage this and how could I pass. Actually, it was just unbelievable to me. Actually, without I believe that a little bit effort I could make it. I
Mm-hmm.
don't know how. Actually, I believe that it is 100%. You are. It is towards you. All credits goes to you
Thank you.
just because of
But
you,
it's
Dr.
so
Shabana.
hard work as well. I mean, because it will be like candidates' dedication and determination. Without that, because as mentors, we are here to guide you people, uh, to keep you on the right track, and then it is your responsibility to be on that right track and to practice and to reach that goal. Well done, Dr. Fahmida. Very well done.
Actually, Shabana, when
Yes.
I was in the exam hall, I counsel myself. That is, I don't have to rush, and I have to be very quiet and don't be nervous. So
Mm-hmm.
always, I think it is very important not to get nervous, because
Mm-hmm.
if there is any nervousness showed to the examiner,
Mm-hmm.
they think that it is actually a candidate is not. I think there is a mark on that, where whether candidate is very confident or not. It is very important. And
Mm-hmm.
another important thing I feel that I don't know how it is common with me. That is 10 stations,
Mm-hmm.
just similar that you taught us. Just 10 stations. There
Mm-hmm.
is no change.
Mm-hmm.
Exactly, it was presented. So
Okay.
that four station I didn't make very good. Two
Right.
station, one station, multiple sclerosis. Actually, in that station, I actually failed. I think applied clinical knowledge, but I always try to showed my sympathy to the patient. I think
Yes.
the examiner will give mark on that station.
Right.
And labor ward prioritization and other structured discussion. First structured discussion, I faced Dr. Uh, Dotto writer, Dr. I recognized him,
Okay. Right.
Hiralal Konar sir. Hiralal Konar sir.
Okay.
I
Nice.
knew,
Okay.
yeah. But
Yes, yes.
just he seated, but
Mm-hmm.
every time, 2 3 times she just leave the room, and I
Okay.
was on that room, and what I was going to say that
Mm-hmm.
but it was a common station. I did feel like that why it was happened with me. That is the at that time I think that thought that it was not possible for me, because two stations was not absolutely good, two borderlines, but 10 stations was very good.
Right.
So I would like to say my next colleagues that if you do at least 10 stations, very good. So don't have to worry about the pass.
Mm.
Actually, you all will pass.
Yes, yes, exactly. So 10 stations, like, yes, if you pass, and I have seen people who pass even in 4 domains,
Yeah.
they clear the exam.
I passed 5 domains and 69%.
Yes, yes,
Yeah.
see. Right, see. So very well done, Dr. Fahmida.
Thank
Very
you.
well
Thank
done.
you.
Yes.
Thank you so much. Thank you.
Okay, my dear. Okay, thank you. Thank you. All right. So we have Sahitya here, isn't it?
Yes, ma'am.
How are you?
Hello.
Congratulations.
How are you, ma'am? Thank you, ma'am. Thank you so much.
So I'm really so happy for you, my dear, and like I must say it's your hard work. So how are you feeling? And tell us about your preparation and also give some advice to your friends.
Okay, ma'am. I feel very relieved, ma'am, from this
Yes,
exam. That is what.
every candidate told me that, ma'am, what a big relief it is. Isn't it? Relieved.
Yes, ma'am. Yes, ma'am.
Okay. Yes.
Actually, it's a kind of big relief. All of a sudden, like my mind is all empty. Like what I should
Yes.
think now.
Yes.
It's like such a kind of stressful long journey with the part 3, part 1 and part 2. I cleared it easily, ma'am, like without any struggle. I prepared myself and I cleared it easily. From part 3, like I did like a really lot of struggle to clear it. Actually, I fought to a mock test initially when I was carrying 2 years back, ma'am, if you remember me. At
Yes, exactly. Yes, Sahitya. That time, I think that was your first attempt, isn't it?
Yes, yes, ma'am.
Mhm.
So at the time you comforted me like so much, like even I took so many breaks. That was an online exam.
Mm-hmm. Right.
Uh,
And
uh,
but
yes, I say the like how stressful this exam, but with your communication and conversation and your guidance is very specific. And you are very humble, like it doesn't feel like stressful, like whenever I talk to you or I presented to you, like even if I practice by myself also, like I feel stressful, and sometimes with my study partner also I'll be like, am I forgetting anything, am I speaking right, there is something background running in my back of the mind, and I will be speaking something. Yeah,
yes.
that used to be happen. But luckily, as Rekha said, like I found a study partner. With Rekha, it is like I able to find like where I am going wrong.
Mm-hmm. Right. So your
Yes,
study partner has to be honest and
yes,
like
yes,
yes. And yeah, it should be vice versa. I mean, you should give the honest feedback. Uh, because that is important. Otherwise, how like you will improve? So even in my course, like
yes,
I,
ma'am.
I will
Definitely.
never discourage anyone, and but I will always point out the mistake, like because that is until and unless someone tells you about your mistake, you will not realize no, that you are committing that mistake and you have to improve. So,
Definitely, like one should definitely have the course. Otherwise, we don't know like what we are preparing and what is right and what is wrong.
yes, yes.
The first we need that knowledge. I must say that you are like exceptionally helpful to me, especially.
Thank you. Thank you.
Yes, like
Because
the simple with the simple answers, and like even if we miss something, like a it's a kind of encouraging words you give. It doesn't make us feel low or burdened that day. And but it is really important to catch up all those points and practice with the study partner, or like practice with our own selves. That is also like the more important thing, what I feel.
yes, right. Yes, Sahitya. Okay, my dear. Okay. Thank you so much and congrats again.
And also I appreciate this Zoom
Yes.
meeting with the past candidates. Like it's I feel really happy to listen all
Yes.
the
And
experiences.
for you and Rekha, I it will be like your double joy for both of you, because both of you are study partners and both of you passed.
Yes, yes,
So,
ma'am.
yes, and for me also,
Thank
it really gives me immense pleasure to like to be with all of you, because I know it was a long journey for many of you. And not
Yes,
it's not an it is not an easy exam. And this time the exam was a bit tough also,
yes, ma'am.
right?
And our recordings, I must say, ma'am, they are very accessible and like with the simple search, like we can go and listen to them.
Hmm.
That library was very good, ma'am.
Yeah, yes, I added the libraries. Exactly. And like now I have arranged all the audios module wise. Before they were all haphazard, but now all the audios I have arranged, all the 14 modules and even the talks. I'm trying to do the summary of talks and add them as well.
Ma'am.
Okay. Thank you, Sahitya.
Thank you, ma'am.
Congratulations. Thank you so much. Okay. So I think anyone else has joined? People are busy actually. So, one common question which you people will be better to answer. What about the books? There are 5 books, isn't it? So, well, what my advice is to the candidates is that uh, you should do the station from the books which you have not done in any course, only the new stations or unfamiliar stations, but doing ectopic from all the 5 books. Is it going to help? I don't know. I mean, I think no. In my point of view, doing all the 5 to 6 books and each and every station, it will be very time consuming. What do you people say? Because I get
Yes,
this question
we
from
don't,
many candidates.
my opinion, we don't need to finish all the book talks.
Mhm.
Except there is some particular station in the books. But if you are far away from the exam, you need to practice from the books.
Mhm.
So that we can have some clues and some approach regarding the different books. Not we don't need to finish all the book stuff.
Exactly. So, the new stations or unfamiliar stations you can do
Yeah. For example,
books or
the
some. Yeah.
cytomegalovirus, like that, it is in the books, and the stage of labor, like that, this in the
Mhm.
books, and documentation regarding the forceps instrumental delivery, it is in the books. So in that circumstances, we need to follow book talks.
Mhm.
Otherwise, um, if
Right.
you are far away from the exam, it is okay. But if you are two months from the exam, you don't need to follow the books.
Yes, initially you can do the books if you have time. Like you people have time right now, those who are going for November, so that you can have an idea about the station. But
Yes.
uh, or if you're studying with your partner, then you can pick one random station from the book and then you can practice that. Uh,
And
mhm.
another thing is, although we have the study partner, the time zone is quite different sometimes. In that circumstances, we can practice. What I practice is the put a small mirror in front of my face, and then
Mhm.
we set the time at 7 to 8 minutes, and we talk in front of the mirror.
Right.
We can
Yes.
like that.
Yes. If your study partner is busy and you are doing stations alone, you can do in front of the mirror so that you can see even your facial expression and everything. And there will be eye to eye contact. Exactly.
Yeah.
Yes. Okay. Any other important tips any one of you can share? Okay. So, all right. So that's all for today. So I'll be ending the meeting and I would like to thank all of you for joining. And hi, Win. Many
Hi.
congratulations. Hi. So may God help you all in your future endeavors as well. keep shining, keep moving forward. And it was a great pleasure to have all of you here. Okay, my dears. Thank you.
Yes.
Thank you so much.
Thank you.
Yes.
Thank you. Good night.
Viva. Yes, thank you, my dear. Thank you. Thank you for giving your precious time, attending the meeting, and giving precious tips to your colleagues who are going to appear in the November exam. Okay, my
Yes.
dears. Thank you so much, and congratulations again.
Thank you.
Thank you.
All right. Okay, my dear. Okay. Bye-bye, and
Bye-bye.
thank you.
Bye-bye.
Thank you so much. Bye. Thank you. Okay, dear.
Yes.
Okay, dear. Okay.
Thank you so much, ma'am. It is not. It is for your effort as well.
Yes, and your hard work paid off. That is that's what I tell to everyone. It was your dedication and determination, because there are very few candidates who passed in first attempt. For many of them, it was second, third, and fourth. So having that courage to keep appearing in the exam, that's very important. So because it is not a piece of cake. I mean, you have to give your 200% to pass the exam, right?
Yes.
Okay. Thank you. Thank you all. Bye-bye and all the best. Good night, all of you. Thanks for joining.
Yes, ma'am.
Okay. Bye.